Cotard's syndrome, also known as Cotard delusion or walking corpse syndrome, is a rare and severe neuropsychiatric disorder in which a person holds a delusional belief that they are dead, do not exist, are putrefying, or have lost their internal organs or blood. Named after French neurologist Jules Cotard, who first described it in 1880, the syndrome is most often associated with major depressive disorder, psychotic disorders, and neurological conditions. Symptoms. The core feature is nihilistic delusion, the belief that something, the self, parts of the body, or even the external world, no longer exists. Symptoms may include belief of being dead or non-existent, denial of body parts or internal organs, e.g., thinking one has no heart or brain, belief that one is rotting or putrefying, feeling immortal in a cursed or undead state, severe depression and despair, hallucinations, in some cases, neglect of personal hygiene or nutrition due to the belief of being dead, suicidal ideation or self-harm, sometimes attempting to prove one's death. Stages, based on original Cotard description, germination stage, characterized by anxiety, depression, and hypochondriacal symptoms. Blooming stage, full development of nihilistic delusions, e.g., belief in being dead or decaying. Chronic stage, the delusion becomes more systematized and persistent, often lasting months or years without treatment. Associated conditions. Cotard's syndrome rarely occurs alone. It is typically a symptom or manifestation of an underlying disorder, such as major depressive disorder with psychotic features, schizophrenia, bipolar disorder, dementia, temporal lobe epilepsy, brain tumors or traumatic brain injury, multiple sclerosis or Parkinson's disease. Causes and neurobiology. Though the exact cause is not fully understood, research points to a combination of psychiatric and neurological factors. Dysfunction in brain regions related to self-awareness and emotion, especially the parietal lobes and frontal cortex. Abnormalities in the default mode network, DMN, which manages self-referential thoughts. Disruption between areas involved in facial recognition, fusiform gyrus, and emotional processing, amygdala, similar to Capgras delusion. Frequently linked to organic brain damage or structural brain abnormalities. Diagnosis. There is no specific test for Cotard syndrome. Diagnosis is clinical, based on psychiatric evaluation. Medical history. Neuroimaging, e.g., MRI or CT scans, if brain injury is suspected. Differential diagnosis to rule out other psychotic disorders. Treatment. Treatment depends on the underlying cause and usually involves a combination of interventions, pharmacological, antidepressants, SSRIs, SNRIs, antipsychotics, especially in delusional or schizophrenic presentations, mood stabilizers, if related to bipolar disorder, electroconvulsive therapy, ECT, considered highly effective, especially in cases with severe depression. Often brings rapid relief in Cotard's symptoms. Psychotherapy, supportive and cognitive behavioral therapy, CBT, often used alongside medication. Hospitalization may be necessary if the patient is suicidal, severely malnourished, or unable to care for themselves. Prognosis. With proper treatment, many patients recover, particularly when the underlying psychiatric condition is addressed. However, delays in diagnosis or treatment can lead to serious health risks, such as starvation, infection, or suicide. The prognosis is generally worse in cases involving organic brain damage. Capgras syndrome, also known as Capgras delusion, is a rare and intriguing psychiatric disorder in which a person holds the delusional belief that someone close to them, usually a spouse, parent, friend, or even a pet, has been replaced by an identical imposter. It is classified as a delusional misidentification syndrome, DMS, a group of disorders involving the misrecognition of people, places, or objects. Named after Joseph Capgras, a French psychiatrist who first described it in 1923, this syndrome reflects a disconnection between recognition and emotional familiarity, making it both neurologically and psychologically significant. Key symptoms. Strong belief that a loved one has been replaced by a duplicate, e.g., this is not my husband, he just looks like him. May also involve misidentification of pets, objects, or even the self. Rare cases. Patients retain the ability to recognize the person visually, but lack the emotional response associated with that person. Suspicion, paranoia, and fear often accompany the delusion. In some cases, violent behavior may result due to perceived threats by the imposter. Often resistant to reason or evidence that contradicts the delusion. Associated conditions. Capgras syndrome is not a standalone disorder but rather a symptom of an underlying condition, including schizophrenia, especially paranoid type, dementia, including Alzheimer's disease and Lewy body dementia, brain injury or trauma, especially in the right hemisphere, involving facial recognition areas, Parkinson's disease, epilepsy, bipolar disorder, during manic or psychotic episodes, postpartum psychosis, in rare cases, neurological and psychological basis. Capgras syndrome is thought to arise from a disconnect between two key brain processes: facial recognition pathway, ventral visual stream. This system allows a person to visually recognize familiar faces. Emotional response pathway, limbic system, particularly the amygdala. This system links faces with the emotional familiarity we normally feel toward loved ones. In Capgras syndrome, the person recognizes the face, but the expected emotional response is absent or blunted. As a result, the brain rationalizes this emotional mismatch by concluding that the person must be an imposter. This theory is supported by neuroimaging studies and is closely related to the opposite condition, Fregoli delusion, where the person believes strangers are actually familiar people in disguise. Diagnosis: there is no specific test for Capgras syndrome. It is diagnosed based on Stendhal syndrome is a rare psychosomatic condition that causes intense physical and emotional reactions, such as dizziness, rapid heartbeat, confusion, fainting, or hallucinations, when a person is exposed to artworks or places of great beauty, especially in large quantities. Named after the 19th-century French writer Stendhal, who described experiencing overwhelming feelings during a visit to Florence, Italy, the syndrome typically affects tourists in culturally rich locations like museums, cathedrals, or historical sites. Though not officially classified as a psychiatric disorder in manuals like the DSM-5, it has been documented in clinical settings, particularly in Florence, where several tourists have required medical attention after such episodes. The condition is considered a psychological reaction to aesthetic overload, often linked to emotional sensitivity, stress, or previous mental health conditions. Symptoms: dizziness or lightheadedness, racing heart, tachycardia, confusion or disorientation, fainting, hallucinations or intense emotional reactions. Alice in Wonderland syndrome, AIWS, is a rare and fascinating neurological condition that affects perception, particularly involving visual distortions, a distorted sense of time, and body image. People with AIWS may perceive objects as being much larger or smaller than they actually are, macropsia or micropsia, and may feel as though their own body parts or surroundings are distorted in size, shape, or proportion. The syndrome is named after Lewis Carroll's 1865 novel Alice's Adventures in Wonderland, in which the protagonist experiences similar sensations after falling down the rabbit hole. Interestingly, Carroll himself may have suffered from migraines and described symptoms similar to AIWS. Core features and symptoms: AIWS is primarily a disorder of perception, not hallucination. The person is usually aware that their perception is distorted, unlike psychotic conditions. Visual distortions: micropsia, objects appear smaller than they really are. Macropsia, objects appear larger than they are. Pelopsia, teleopsia, objects seem closer or farther away than they are. Distorted faces or bodies may seem stretched or compressed. Body image distortion: person may feel that their own limbs, head, or torso are enlarged, shrunken, or misshapen. A sense of floating or detachment from one's body is also reported. Time distortion: time may feel like it's speeding up or slowing down, similar to a dreamlike state. Auditory and tactile distortions, less common, sounds may seem louder or softer, or coming from the wrong direction. Sensation of touch may feel exaggerated or distant. Causes and associated conditions: AIWS is not a disease but a neurological symptom, and can be caused by various conditions, including migraines, especially in children and adolescents, epilepsy, particularly temporal lobe epilepsy, infections, such as Epstein-Barr virus, EBV, a common trigger in children, influenza or other viral illnesses, brain lesions or trauma, psychoactive drugs or hallucinogens, stress or sleep deprivation, psychiatric disorders, e.g., depersonalization or dissociative disorders, less common, who is affected. AIWS most often affects children and adolescents, particularly those who experience migraines. It can also occur in adults, especially those with a history of migraines, seizures, or certain infections. The condition is typically benign, though distressing. Clinical lycanthropy is a rare and unusual psychiatric syndrome in which a person has the delusional belief that they can transform into a wolf or other animal, or that they have already undergone such a transformation. It is named after the mythical concept of lycanthropy, the ability to turn into a werewolf, but in psychiatry, it refers to a delusional misidentification syndrome. Belief in being or becoming an animal, usually a wolf, dog, or sometimes a snake, cat, or frog, may involve animal-like behavior, such as growling, crawling, or howling. Often co-occurs with schizophrenia, bipolar disorder, or severe depression with psychotic features. May be accompanied by hallucinations or depersonalization. Causes, typically linked to underlying mental illness. Possible neurological involvement, temporal lobe dysfunction. Alien hand syndrome, ARS, is a rare neurological disorder in which a person experiences one of their hands, or sometimes a leg, as acting independently, without conscious control. The affected limb may perform purposeful movements, such as grabbing objects, undoing actions made by the other hand, or even striking the person, as if it has a mind of its own. The individual retains full sensation in the limb but often feels a loss of ownership or control over it. First described in the early 20th century, alien hand syndrome is sometimes called anarchic hand, or Dr. Strangelove syndrome, after the character in Stanley Kubrick's film who cannot control his arm. Core symptoms: involuntary but purposeful movements of the affected limb. Lack of voluntary control, despite no paralysis. Person perceives the limb as foreign or possessed. Conflicts between hands, e.g., one hand buttons a shirt, the other unbuttons it, may interfere with daily activities or cause emotional distress. Types of alien hand syndrome. ARS is classified based on the region of the brain affected. 1. Frontal variant, caused by damage to the supplementary motor area, anterior cingulate cortex, or corpus callosum. Typically affects the dominant hand. Common symptoms: grasp reflex, hand grabs objects involuntarily. Groping movements. Utilization behavior, the hand compulsively uses nearby objects. 2. Callosal variant, involves damage to the corpus callosum, the bundle of fibers connecting the two brain hemispheres, results in intermanual conflict, one hand undoes what the other does. Often seen in patients who have undergone corpus callosotomy, a surgical procedure for epilepsy. 3. Posterior variant, linked to damage in the parietal or occipital lobes or thalamus. Usually affects the non-dominant hand. Sensory alienation, the limb feels foreign. Involuntary movements often more complex. Visual spatial misperception,